Our project is about spatial biology for risk stratification in colorectal cancer. Colorectal cancer is a significant health burden in Switzerland. It ranks as the third most common cancer in both men and women. A particular challenge in the clinic is when a patient has colorectal cancer, it is important to classify that patient according to their risk to give them the optimal treatment path and outcome. An important question for us is, can we identify cancers that can be cured by surgical resection alone? And can we differentiate them from cancers that will need adjuvant therapy, in particular chemotherapy, immunotherapy, or targeted treatment. Now, in our project, we are aiming to explore spatial biology, so the interaction of the tumor with the tumor microenvironment, to differentiate aggressive disease from disease that can potentially be treated by surgical therapy alone and can spare patients chemotherapy.
Currently, it's very hard to predict which colon cancer patients are going to have a relapse of disease. Clinicians have to make very tough decisions with limited amount of information. So what is unique about our project is that we first of all are going to create really detailed spatial maps of this disease by using two different imaging techniques. Secondly, we have access to this very large cohort of about 1,800 colon cancer patients for whom we have tissue blocks. We also have the outcome, so we know if they relapsed or had a good outcome.
Our collaboration between Professor Moor and myself started actually quite a few years ago when we were both starting off as independent researchers in Switzerland. Coincidentally, we met on the first day of starting our professorships at the University of Zurich at the time, and we got into conversation and we very quickly found out that we were looking at the same problem from two different perspectives. Professor Moor from the basic science perspective through methods of molecular biology, me looking at the same problem from the clinical pathology perspective, so diagnostics looking directly at the patient samples.
What is really transformative for us is we have been talking about a project like this for quite a few years, but now, first of all, it's technologically feasible, and also we have now the financial means, thanks to the ISREC Foundation, to really propel this initiative, to start this collaboration and to answer these questions with an unmet medical need. So this is a discovery project. We hope to uncover new markers that are correlated with the outcome of disease in colon cancer patients. We now do this retrospectively. Of course, we have to then validate it in new patients. And if that validation is successful, then in the future, we hope that we can use this in a diagnostic manner at some point for new patients to help the clinical decision making and to give a more precise therapy.